Gloria Freilich. I'm the founding president of EUROPA DONNA.
My name is Elisabeth Bergsten Nordström and I'm the president of EUROPA DONNA.
My name is Susan Knox and I'm executive director of EUROPA DONNA, the European Breast Cancer Coalition.
Well, the involvement in breast cancer advocacy is a very personal one, as with most of our advocates.
I was diagnosed with breast cancer in 2002.
I had breast cancer myself.
And in 1999 my breast cancer was detected.
I first became involved in EUROPA DONNA after being diagnosed with breast cancer for the first time in 1996.
And I was diagnosed with breast cancer myself.
I was diagnosed with breast cancer in 2000.
I'm a breast cancer survivor.
I joined EUROPA DONNA Turkey after being diagnosed with breast cancer.
It's almost 20 years because I am a survivor.
I brought together a committee representing 7 original countries, and we put together the 10 goals. We put together a modus operandi, the original constitution. It took us about 18 months to get things together ready to launch.
Nowadays we have 46 forums in European countries.
EUROPA DONNA has had a lot of impact on the improvement of breast services for women in all parts of Europe over the last 10 to 20 years.
The landmark thing was lobbying the European Parliament for the 203 and 206 resolutions. That was really exceptional, and I think especially the political advocacy and lobbying work is what is the most important.
From the beginning, we've been involved both in legislation that helps women get better services, but then that moved toward the guidelines being developed, the European Guidelines for Quality Assurance in Diagnosis and Screening of Breast Cancer. And we were on the working group that set up and developed these guidelines, and we then translated them into 13 languages, a short guide to the guidelines.
It's a great tool for all the member countries. We also collaborate and work very closely with the professional organizations, the healthcare professionals, and thereby learn a lot.
We have to talk to all our stakeholders.
I think EUROPA DONNA has really made a change in that and the difference in Europe, in that we now are a partnership, and also women are better informed and educated about what they need to know.
The role of EUROPA DONNA, I think, is a high standards in all. High standards of care, of information, of first of all, of access.
High quality treatment, high quality diagnosis, high quality rehabilitation and follow-up.
It's very simple. All women have right to have all information about the breast cancer.
When you are diagnosed, you are in no way prepared for it, and it's important to have easily accessible information, for instance on the internet.
The most significant role is the education of patient advocates.
Every woman should have access to clinical trials.
We have a lot of young breast cancer patients. It's hard to believe that a teenager would think about the disease.
Priority now is survivorship because of the good treatments, good detections, early detections. Now we live longer.
We can still improve the number of women who go to the screening programs in their own countries. Not everybody goes, and if we would increase the number of participants, we would decrease mortality.
The main advocacy priority would be to encourage women to take care of themselves, healthy living, healthy eating and exercise are hugely beneficial in the prevention of breast cancer.
Most women, they are faced also with emotional trauma, which is caused by cancer, and it's sometimes as painful as the disease itself. And I do believe that in this field we have a lot of work to do.
I think we have to be seriously working on the clinical trials on cancer research, and patient advocates should be getting involved as the main stakeholder, as the focal point in all the clinical trials.
EUROPA DONNA really needs to emphasize and focus on the need for accredited breast units to be available for women in all European countries.
Access to accurate information and to clinical trials.
The most important thing is that women have to be aware of their rights. Health is a human right, and good and quality services are a right to every woman all around Europe and in the world.
Please join us in making sure that all of the women in Europe have access to mammography screening programs set up according to EU guidelines and access to be treated in specialist breast units set up according to those guidelines.
Дорогие женщины,
Hepinize sağlık, mutluluk dolu günler diliyorum.
aiutateci a sostenere il nostro progetto.
Stöd Europa Donna.
Únete a nosotros.
Doe met ons mee.
Mobilisons-nous toutes.
Europa Donna łączy wszystkie kobiety Europy.
Καλή να είσαι δέστης.
Ενώστε τις φωνές σας μαζί μας.
Bitte machen Sie mit.
Vi hoppas att du vill stödja våra ansträngningar.
Pridružite se nam,
Please join us.